Dumbbell lateral raises are one of my personal favorite shoulder hypertrophy movements, and they're a staple in the programs of many lifters, whether they're powerlifters, bodybuilders, Olympic weightlifters, or just people who generally like lifting weights. They're a great movement to build big, wide delts and support your performance with things like benching, overhead pressing, snatching, and other upper body pressing dominant movements. However, if you're dealing with shoulder pain, dumbbell lateral raises are often pretty painful when you try to do them. This leads many lifters to think that they have to just stop doing lateral raises in order to solve their shoulder pain, choosing between shoulder pain and shoulder gains. My name is Ryan Van Nieuwenhuis. I'm a doctor of physical therapy and a fellow lifter, and today I'm going to show you 3 of my favorite lateral raise variations I use with my clients to help them keep on training their shoulders even while dealing with shoulder pain. One of the main reasons why dumbbell lateral raises can cause such a problem for some lifters with shoulder pain is because a lot of lifters who have shoulder pain have something that we call a painful arc. This is a pattern of shoulder pain in which the pain is either minimal or none at all at the very bottom of the motion, and then as you move towards the mid-range, it gets the worst, and then it often does get better as you go above mid-range, sometimes also increasing at the very end of the range of motion as well. The thing with dumbbell lateral raises is because of how physics works. The movement is going to be the hardest right at that painful position in the mid-range of motion, and it's going to force your shoulder musculature to work the hardest in this position. So sometimes dumbbell lateral raises can be quite provocative for people who are dealing with shoulder pain. So instead of just giving up on your lateral raise training, give these 3 variations a try. The first is an incline bench scaption raise. For this variation, you're going to grab an adjustable bench and set it to an incline that's a fairly steep angle. Grab a pair of dumbbells and lie face down on the incline bench. From here, you're going to raise your arms in a lateral raise motion, but instead of going directly out to the side with your hands, you're going to angle your hands and arms a little bit forward so that you're not directly to the side. This is something called the scapular plane, and it can be a lot easier on your shoulders than going directly out to the side like in regular dumbbell lateral raises. You can also adjust the incline of the bench and the angle of your arm to find the combination of positions that's the most comfortable for you and that allows you to train the hardest. The next variation is a behind the back cable lateral raise. To do this, you're going to set up a cable so that's a little bit lower than hip height, so that when you're holding the cable at the very bottom of the motion, the cable is parallel to the floor. From here, you're going to step forward and to the side a little bit so that the cable wants to pull your hand behind your back, and then you're going to perform the lateral raise, moving your arm in the same scapular plane as in the prior variation. This lateral raise variation is honestly one of my favorites for my clients with shoulder pain because of 2 reasons. First, because of the physics of the movement, it's the hardest at the bottom of the motion where people's pain is typically the least, and it's easiest at the top of the motion where people's pain is typically the most with regular dumbbell lateral raises. Second, you're once again moving in the scapular plane, which can just be a little bit more comfortable when you're dealing with shoulder pain itself. Because of that, a lot of people who have shoulder pain can push this lateral raise variation quite a bit harder than other variations and get a much better training effect. And the last variation is a lying dumbbell lateral raise. Grab an adjustable bench and set it to a relatively shallow incline. Next, grab a dumbbell, lie on your side on the bench, and either have your hand in front of your body or behind your body to begin with. Both are totally fine, they're just going to stress your shoulder in slightly different ways. From there, simply raise your arm up in a lateral raise, going as high as you can within your comfort. For this variation, I recommend that my clients experiment with having the hands start in front of their body or behind their body, finding out which one feels best for them, and then pushing that one. The great thing about this variation is that because of the position of your body relative to the weight, it makes the beginning of the motion quite a bit harder on your shoulder and the top of the motion quite a bit easier, similar to the cable lateral raise variation, but this time with a dumbbell. And because of that, it can help reduce any shoulder pain that you would otherwise experience in the lateral raise. Just because you're dealing with shoulder pain, it doesn't mean that you have to stop doing lateral raises. Try these variations, find what feels best for you and allows you to get the most training in, and then push that over time. I recommend most of my clients starting with lower loads and higher reps per set, and then increasing those relative to their goals based upon how they're progressing with pain. And make sure to subscribe to my channel to learn how to solve your injuries and your pain without having to stop the training that you love.